Sorry. My name is Or Lumnitz. I'm the head of marketing here in IDENTI Medical, and we are here to discuss the most important thing, boost revenue cycle performance, how image recognition transforms implant capture. We have a lot to fit in, so if you have questions during the presentation, please type it into the chat box and we will answer later at the end. I would like you to meet our presenters. Shlomo Matityahu, he is the founder and CEO of the company, and Bill Doyer, which is the senior solution expert. And I would like to hand it over to Bill.
All right, so let's talk about the webinar objectives. We're going to try to identify the current revenue capture challenges in the OR and the procedure rooms, and I know you guys are well aware of them. And then we're going to understand what the cost is, not just to the revenue cycle folks, but to everybody in the hospital. Then we're going to introduce to you the image to data revolution, which is a different way of collecting data that's a lot easier on people. And we're going to demonstrate that new technology to you and show you what it looks like. All right, so the cost of poor documentation hits a bunch of different places. We're going to talk about patient safety, revenue cycle reconciliation, and inventory control. In terms of revenue cycle reconciliation, this is a figure that comes from HFMA, and it says that $1.5 billion is the average usage loss for U.S. hospitals due to uncaptured medical products. These products are expensive, and if you end up using them and not billing for them, it gets really expensive really quickly. This figure comes from the American Medical Association. This is directly tied to patient safety. Between $5 and $7 million is the average hospital cost for a malpractice suit that results from the use of an expired or recalled product. So, keeping these products out of the OR and out of the patient, obviously, is not only the right thing to do. It's a very inexpensive, or it's a very expensive problem if you do it. And then again, this one comes from HFMA, and it talks about an individual hospital. $1.3 million is the average U.S. hospital cost for OR loss during the year due to supply chain inefficiencies. And we're going to define this for you going forward. So you look at a big picture, $7.7 billion hits not only the revenue cycle folks, but if you're supply, you understand the preference card problems, the item master problems. If you're in contracting, you know that data is vital if you want to have a good contracting position. Regulatory compliance can kill you. We talked about, for example, lawsuit costs, but we didn't talk about inspectors coming in and causing problems for you. Nurses go into nursing to treat patients, not to do supply chain and revenue cycle, and so they get very dissatisfied. And then you're looking at retention issues. Again, getting back to the supply chain folks, consignment inventory, supply contracting, there are just so many things, so many pieces to this pie that add up at the end of the day to about $7.7 billion. So let's look at probably where it's the toughest, and that's, for example, trauma cases. They come in through the OR, for numerous reasons, wounds, stabbings, whatever. Unfortunately, it's 24/7, it's 365 days, and it's not, you can't guess when it's going to happen. So the inventory has to be on hand at all times. They also have minimal time to properly prepare. If you've got a case tomorrow, you pick the cart, everything's there, everybody's ready to do what they need to do. In an emergent situation, patient shows up with a really serious problem, and you've got to do it really, really quickly. So once the surgery starts, there's very little time for anything other than patient care. So in most cases, hospitals have a system by which they try to capture all of the data that during an elective surgery they would have, been able to chart as they're going along, and they try to figure out a way to get that into the patient chart and then all the subsequent areas that it needs to go to. So if you look at what that costs you, just in direct costs, you're going to miss a lot of charges. A lot of stuff is going to be used during this procedure that, because of time and the emergent nature of it, is not going to be captured. And that's about $1.365 million. And then because somebody still has to get as much of that information into the chart and into all of your systems, somebody's going to have to go back after the surgery and do that, and then someone else is going to have to cover their spot. So that's another $200,000. And this is for, a hospital about the size of with about 10 Snap and Go units, which we'll talk about later. And then because this is a kind of a problem area, it's audited on a regular basis. So throw in another $20,000 there. And then there's a huge problem around unused items that need to be documented. You open 3 things, you use 2 of them, maybe 1 of them, whatever. You still need to document the other ones for a myriad of different reasons, and that generally doesn't happen. They get the important stuff in there, all the other stuff doesn't show up. So you're looking at almost $1.6 million in direct costs to a hospital. And then on the indirect side, ORs need to be ready for, especially trauma ORs, need to be ready for any type of surgery, so they always carry a bloated inventory. And there's 2 costs associated with that. One is you end up carrying way too much stock. And that's literally money sitting on the shelf. And you look at that $2.07 million number and you say, how can it be that high? Think about what these things cost. They're sitting on the shelf for 2 years, never used. And so that's tying that money up, and then turn around and throw it away, 5 to 10% of that stock, you lose 100% of it there. So you lost the cost of money, you lost the actual item itself 5 to 10% of the times, and that that racks up to more than $4 million, and it racks up very quickly. So let's also talk about patient safety. And in this case, we're going to talk about an implant recall case that happened in 2019. It was the Allergan textured breast implants. Way back in 2013, which seems like forever ago, the FDA decided that they needed to put unique device identification on every medical device. And then in 2019, they said, or 16, they said, okay, let's make sure that we're doing the class 3 devices as well. Well, early in 2019, there was in Canada, they started to suspect that perhaps these Allergan textured breast implants were cancer causing, and unfortunately, they were correct. So in 2000, I guess that happened late 2018. In 2019, the US FDA did a class 1 recall of all Allergan breast implants, the textured breast implants. The problem with that was a year later, so in 2020, they unfortunately identified the fact that, yes, they were causing cancer, so now it was confirmed, and that there were 33 deaths directly associated with it. The worst part of this whole story is that 52,000 patients couldn't be found within a year. So there's 52,000 patients walking around out there right now with breast implants that we know can cause cancer and kill people. So again, this originated in Canada. So the University of Montreal did a study. Number one reason that they couldn't track these people down was because of a lack of implant traceability. Everybody's got, if you look at the second bullet point, everybody's got a implant registry at their hospital. In the old days, it was a book. Sometimes you put stickers. There's a million different ways to do it. That may work, for example, for billing, but it doesn't work for recalls if it's not searchable. So they talk about building a national implant registry that's searchable. But unfortunately, after everybody looked at the problem and said, yeah, there's 52,000 patients walking around, the FDA said, we're not going to get a hold of this at the hospital or vendor level. So we're going to put the onus on the patient. So if you get a pacemaker, for example, they hand you a card and they say, if you ever hear this, there's a recall, check your card, make sure it's not you, which is an absolutely horrible way to do it. So in terms of patient care, we're failing the patients if we can't identify which patient has which implant.
So first of all, Bill, thank you for for the intro of the current situation in the market and the revenue loss that hospital and providers are facing. We understood that one of the main reasons for that is the lack of information or the lack of data in the point of use. And the question that we have been asking is why do hospitals fail to collect 100% usage data at the point of the point of care or the point of use? And this is one of the challenges. We believe that if you will be able to solve this puzzle, why it's like that, so then you might come with a type of a solution which will be improving the business process at the hospital. So when we look at that, we found that there are main four factors for that. The first one is the reliance on the medical staff. It is clear that the right place to collect data on what have been used for a procedure is at the point of use. And in the point of use, the only way to do it is by getting some help from the nurse. And if you will ask the nurse, what is your job during the procedure, they will typically tells you, we need to take care of the patient, to help the physician to perform the surgery in the best way, and to make sure that there is no any safety issues during the procedure. So they are not perceived themselves as people that need to collect data. Most of the nurses that we have been speaking with have been saying, data collection, it's not our job. We are not material management. We are not procurement. We need to take care of the patient. So the reliance on the medical staff, it's an issue, and it's clear that it's supposed to be there. So we understood there is kind of a contradiction here that we need to figure it out. From one end, we can get the support from the nurses, and from the other end, we need to take off much of the loads, the workload that is on the nurse, mainly the administrative piece, and let her keep working on the patient safety, helping the physician. The second element, which I believe that you will see it as a very weird, let's say, point, is dependency on barcode. We understood that not like other industries that are, like the retail industry or other industry, the dependency on barcode is an issue at the hospital, and it's created a lot of challenge for the nurse. For example, if you look at this specific, just a small example here, if you look at these specific item that is here, it's a pacemaker, whatever it is, not pacemaker, but a stent, and you can see that there is 6 barcode there. So what barcode to read? Now we need to train the nurses what barcode to read, not talking about the fact that you need to maintain the barcode, you need to be able to read the UDI, the GTI, and all of this structure. Typically, when the nurse would like to do so, and she struggled with the right barcode, and she remembered that with Johnson & Johnson, she read this barcode, and Medtronic, the other barcode, with Biotronic, the third one, etc., etc. She still sometimes tried to read the barcode, and she's not able to read the barcode. So the dependency on barcode, we see it as an issue in data collection at the point of use. The next part is the software. Now, imagine yourself as a nurse. You are now standing at the operation room using Epic, McKesson, Cerner, all of this complex software, and now you need to be trained to use the system, to interact with the software and with all of the messages, know exactly that you need to drop down here and fill the information there. And if this is, you need to enter the batch ID and the expiration date. The system need to be defined as this item as an implant. And now you need to go to the second screen of the Epic and key in the information on the second screen. Second screen, the complexity of the software is an issue. And now, if you look only from the training perspective, we have one shift of let's say average hospital with something like 50 nurses. We have sometime it can get to 100 of nurses in one shift. Now you need to train them, and they are all the time changing location, changing position. The art of the software, we found it is also a crucial element that affect the data collection capability. The next point is is what we call the item master. Typically, when I'm visiting hospitals and I'm asking the hospital, what is the status with your item master? So I typically get two type of answers. We are either before item master cleanup or just after item master cleanup. Some of them say we are in the process of cleaning up the item master. The item master typically in most of the hospital are not up to date. And if you would like to deploy the ability to read the manufacturer reference number and then associate to the hospital reference number, it's very complex situation for an hospital. And one of the challenges here when we look at that, as I said before, the hospital market, the hospital environment is totally different than other industries. In the other industries, let's say speak about Walmart. When you got to Walmart, if you would like to sell something via Walmart, you need to prepare it to be ready for Walmart use. But if we are talking about the healthcare industry, nobody can ask Johnson & Johnson to bring the product in a way that they can read it in the system in a simple way. So what's going on is all the time the hospital are trying to maintain this item master, and typically is result in a situation that when the nurse would like to report something to the patient, she, in many cases, she gets some kind of messages. The item is not in the database. There is no inventory. How can you report it? This type is not a pack, is an each item. You know, all the time there is issues that you need to maintain all the time. So we realized that this 4I element is a very crucial element, and we think that the fact that there is inability to collect the data is those elements, and most of the ways or methodologies today to overcome the problem and to get to 100% data collection is typically with software and processes which are dealing with the symptom. So if I do not know how to do it and the nurse time is not enough, let's have additional FTE sitting outside of the operation room, and the main role of this nurse is to typing the information. Only Janet knows how to use the Epic or the Cerner to report the item. Let's use a different software solution which support UDI or other kind of things. So typically, the type of solution that are getting into the operation room today, it's mainly dealing with the symptom and not dealing with the root cause of the problem. And we believe that in order for us to be able to solve the problem, you need to deal with the root cause of the problem. And the solution, according to our research and our understanding, is using image to data. And what we would like to talk during this presentation is the image to data revolution. How we see the market to be acting the next 5 to 10 years. And this is what we would like to try to focus and we try to understand. Now, what we see is that if we have the ability to overcome those 4, let's say, main elements that affect the data collection level, so then we will be able to provide a very robust solution, not dealing with the symptom, but dealing with the root cause. The image recognition is the one of this capability. Let's say if we are working with image, so and if we have an image of an item, so we can avoid the need for data entry because we can use AI, machine learning, many advanced technologies to extract information from the label itself, no matter what is the type of how the information is written on the label, on the product package. The second element, so there is no key in. So we would like now the nurse that she will not key in any information. The second element is no barcode scanning. We do not need, when you are taking an image and you have a capability to extract information and to convert it to data in the right way, you do not care about what barcode to read. So this is something that the nurse do not need to interact anymore, and she do not need to be learned anymore. All of the issues of the patient safety association, the way of data collection in this way by using image recognition, the information, the system can send online real-time alerts. So now what you're doing also, you avoid situation in which you're using an expired item or item in a recall, which we believe that the right place to do it, the right place to collect the data is to handle expired and recall is to avoid it. But in most of the cases, the last line of defense is inside the operation room, and the ability to get online alert in this regard is crucial, and it can be provided by image to data technology. And and last and not least, the nurses do not need to handle with anything as long as we have the image. Imagine yourself that now somebody that is sitting at the procurement or somebody that is sitting at the logistics, you have an image of the item that have been used. So we can answer all of the question that in the today life, the nurse need to handle it. So the nurse, if she is not able to collect any data or to report the item to the patient, she now need to take the item and run to the procurement. Hey, I wasn't able to report this item. Please fix it for me. Or need to go to the procurement and do that. And she need to keep the packages and to handle it. Or in other way, go out and give it to the other nurse, the new nurse that have been the new FTE that have been recruited in order to report the item to the patient. Typically, what the nurse will say, "Oh, let's leave it. I'm not going to report, and I will leave it to other people." So what we found, what we believe that the ability to take an image and to convert it to data, this bring the surgical space to 100% data collection, meaning that with this type of technology, with imaging technology at the point of use, we can take the level of accuracy of data collection accuracy to 100%. And it's including all of the information that is needed for that. Now, if you would like to talk about the power of 100% data collection, so we can go back to the start of the discussion in which Bill have spoken about what are the losses and what kind of risk the hospital is taking with patient safety and other elements in order to understand. So imagine now we are having 100% data collection. Let's speak about the value here. Please, Bill.
Thank you. Okay, so what Shlomo just told you is that we can collect all the information on a product, whether there's a barcode or not. Think about 100% data collection and what that will do in several areas. So first, let's talk about surgery pricing and financial decisions. You guys spend a lot of money, everybody spends a lot of money on analytics software. And analytics software is as good as the data that goes into it. If you're an average hospital collecting 48% of what goes into the patient or what is used in a procedure, your analytics data is not worthless, but it's directional at best. Imagine now you've collected 100% of that data, and you're going to make decisions, for example, about whether a surgery is cost effective or not. Is this one surgeon very cost effective? Is this other surgeon less cost effective? What can we learn from surgeon one that we can translate to our entire organization? Without precise data, if you're catching half the data, you can kind of get an idea. And then you can try to convince those surgeons. If you have 100% of the data, you can say, here it is, it's irrefutable. Think about preference cards. You've got a physician that's got a preference card for this procedure, and it has 35 items on it. Well, you'll now have utilization data where you can say, look, there's 35 items on this preference card. You use 15 of those items every time you do this surgery. You use this other 5, let's say, 20 or 30% of the time, and these other 15 are never used. So what are they doing on the preference card? Why are the materials management people pulling it, putting it on the cart, sending it upstairs, turn around and send it back, put it back, hope it didn't get damaged along the way and we have to throw it out or lost or whatever. So imagine if you didn't have to pick 35 items for every surgery and you could clean up these cards. once you can nail that down in terms of what you're using, your ability to drive pricing with your vendor is better. Your ability to negotiate with your payers. Your payers know that you don't have great utilization data and you don't have great documentation. So when they argue with you, they throw data at you and you don't have data to counter it with. In this case, now you've got that data and you can say, no, let me show you why the cost of this surgery is, whatever it happens to be. Here are all the components, and we're going to give you 100% of that collected data to throw in there. And then again, if you want to start doing if you want to start looking at impact on care and say, why are we using these high cost items when these lower cost items have the same or better, efficacy or impact on the care? Again, without data, it's hard to argue with people. With data, it's irrefutable. Okay, so let's talk about what happens afterwards. Now you have to start auditing, and you spend a lot of time and effort auditing because you're not collecting data. Also, the revenue cycle people are doing auditing because they'll say, well, this procedure was done. We would have expected to see this item or that item. That's a revenue cycle problem, but it's also a patient safety issue. Again, I'm going to go back to the Allergan case and talk about the fact that if it's not in the chart, if it's not in a searchable place, the data hasn't been collected, recorded in a place where it can be pulled up, which would be in your Epic or Cerner system or our system, it doesn't matter. It's useless data. So Shlomo talked about on-site, at the point of care, real time, reducing the risk of expired or recalled items. And if you remember, the price tag on that for a malpractice suit is between $5 and $7 million. If you get a real-time alert that says, hey, do not use this item, and it'll show up on the screen in red and yellow very clearly, you can't miss it, and you don't use that item, you don't put the patient at risk, you don't put the hospital at risk, which is the second bullet point there. And then think about all of the Joint Commission and every other regulatory body that wants to come in there. Everything they ask for is data related. Show us the data on this. They pull 100 charts and they audit 100 charts for you. If you want to comply with their regulations, and I know there's a lot of them to comply with, having 100% of the data will help you do that. If you've collected the data, they can't complain that you didn't collect the data. And then again, we talked about the recall piece. And I know I keep harping on it and coming back to it, but if I'm one of those 52,000 patients, and that's just one recall, if I'm one of those 52,000 patients walking around with a cancer-causing implant, I'd really like to know that. So from the materials side, if you remember, we talked about there's at least 25%, and I think most of you would agree that there's more than 25% more inventory than you need. So the reduction in inventory does a lot of things for you. I've never been in an OR area where they say, we just have too much space. So there's space that's being used for a bunch of items that shouldn't be there, or inventory that shouldn't be there. There's a lot of management that goes on there in terms of, is it expired? Is it not expired? Is it first in, first out? There's all kinds of stuff, of additional work that happens when you have additional inventory. It also makes it more difficult to look at some of the specialty items, your non-common but very expensive items that you need to have on hand, but they're difficult to manage because they're in an overcrowded area. If I'm working in supply chain, and Shlomo alluded to this already, Item Master is a constant source of problems for us. And we're going to talk in a minute about our back office and how they provide the information to the materials folks to help clean that up. But every time something that pops up that's not in the Item Master pops up, they're going to get a notice about it, and they're going to be able to manage it proactively as opposed to reactively. Again, we talked about data. We spend a lot of money in this industry on analytics data, retrospective, prospective data, whatever. And if you don't have 100% of the data, if you don't have anywhere near 100% of the data, it becomes directional at best. Again, it's not useless, but it's certainly not useful for forecasting. And the dream of all materials folks is to get organizational standardization for a million different reasons. But it's important. And again, data is what allows you to do that.
So again, thank you, Bill. Let's speak about the snap and go. We speak about the image to data revolution, and the way that we have implemented this revolution, sorry, is by using a device which we call snap and go. The idea of the snap and go, as you can see, is a device that do not have any keyboards or anything that you need to deal with a mouse and other kind of things. And the idea here is just to place the item on top of the green pad. And it can be sterilized pack, it can be implants, it can be suture, it can be everything that you would like to manage. The only thing that the nurse need to know is to place the item with the label facing up. As long as she got a green light around the green pad, so she's good to go. The system have taken the picture, and the information is now presented on the display itself. Now, the information that the system is collecting, no matter what is the item, is inclusive all of the details. You have the batch ID, the serial number, the expiration date, the lot number, all of the information that is actually written, manufacturer, place of manufacture. All of this information is extracted from the label and presented. Now, in case that the item is expired or in recall, so then immediate alerts is appear on the screen. So now the nurse can know that this item she's not supposed to use it, and she need to take it out from the and delete it from the system. Now, the way that the system work, I see a question about are we reading the screw nuts and bolts in a tray. So I'm sure that you are familiar with the count sheet. The count sheet enable the system with the ability to extract the information from the count sheet to data by just placing the count sheet on top of the green pad. So as soon as the nurse places the count sheet on top of the green pad, the system extracts the information, which include the manufacturer reference number and the quantity that have been used from each item into the snap and go device. Now, if you look at the way that the system is work, so it work in a very simple way. There is four main, let's say, components in the system. The first one, of course, is the snap and go device. The main idea of the snap and go device is to provide to the nurse immediate information which is related to the fact that we have what we call a good area of information, meaning that we got a good image. This take 1 second. As long as we got this 1 second, this information that we have good picture, so she got the green light. This take 1 second. Now, the second portion of the system is the ability, the AI and the machine learning capabilities, which located on the cloud. The image is going to the cloud. The system is activating very advanced algorithms and machine learning, and the system extract all of the information that is on the item itself, and which include as I said before, the reference number, the batch ID, etc., etc. All of this information is sent back to the unit itself and displayed on the screen. This is exactly what the nurse she's seeing on the display. Now, the information is going back to the screen only after we make sure that all of the information is 100% accurate. The system, and this leads us to the third section, or let's say building block of the system, which is a global database and the machine learning algorithms. The system we are holding today, the system is holding something like 800,000 different manufacturer reference number for all of the vendors. And the first thing that we are doing when we extract the information from the package, we compare it to the data that we have. The last and not least piece of the building block in this technology is what we call the human back office services. Every image that somehow, from any reason, it's not identified correctly, or there is it's got a low rank, what we call, is going to human back office, which look at the image, see the information, what have been extracted automatically by the system, fix it, teach the system, and now next time that the system see this information, it's actually this image can the system can extract the information automatically. So this is the snap and go. This is the image to data revolution, and this is what we are doing in this regard. Bill, you would like to speak about the case study?
Sure. One more thing on the human back office. If you remember when Shlomo was talking earlier about an item that doesn't show up, how much work it is to get it into the system because it's not in the item master or whatever, the human back office also identifies, it looks at two databases. It looks like global and it looks at the item master. If it's not in the item master, all the work that people used to have to do to track down the information needed to put it in the item master or be able to bill it is now automatically sent to the hospital wherever you deem it needs to go. It's definitely going to go to the supply chain people because they need to make a decision as to whether or not they want to put it in the item master. But it also, the revenue cycle people will have access to it for billing. So let's talk about a case study, and this is a small case study in a heart and vascular leg center and ambulatory surgery center. The challenges that they had in the beginning were the challenges a lot of people have. They were manually counting stock. Their charge capture was less than 60%. They were leaving a lot of billable items, i.e. money, on the table. They weren't being documented, and also for patient safety, they weren't being documented. They had high levels of waste because they were carrying too much inventory, and they had documentation issues every single day. So after they instituted this image to data system, they were actually able to access our database, and there's a lot of value in that. Your database tends to be your item master. Our database is everything we've ever seen ever, and everything that we've ever loaded into the system. So if something shows up that's not in your item master, it's not a problem for us. They were able to start doing data-driven replenishment. The ORs are a black hole for most materials management teams. They know what they send there, but they don't know what they use. This gives you 100% accurate assessment of what's been used every day by case, every week, every month, every quarter, however you want to do it. Again, recall readiness, if it's not recorded in your system and our system or our system, it is of no use in terms of recall. So this gives you the opportunity to either look it up in your system or look it up in our system and say, this item from this lot number to this lot number, did we use it? Yes, we used it. It needs 5 procedure numbers. You guys look up the patient, you notify the patient. And again, the item master, going back to that human back office, the item master is constantly being updated. We don't update your item master, but we give you the information. We say, hey, this item went through your OR yesterday. It's not in your item master. Here's all the information you need if you want to add it. So look at the results, 95% capture, and that's going to get better and better as they get better at using it. 70% reduction in documentation time by nurses, which means either the next case comes in faster or the nurse is back to patient care. 100% prepared now for product recalls, and a huge reduction. I lost it. You took it off too fast.
Yeah, because I want to leave some time for questions. So okay. Yeah, we have 4 minutes for that. So I will send the presentation later, so you can understand more about IDENTI. So first question was, will it change the OR workflow, and how long is take to train up the nurses? Shlomo?
Yeah, the training piece is very simple because from the nurse perspective is no brainer. The only thing that we need to learn the nurse is to place the label facing up on the green pad. So the nurse piece it's negligible. It's few minutes and she can start working with the system.
Okay, can the step and go transfer data into both the OR record? And also there was another question about the supply chain software.
Sure. The main idea of the Snap and Go is the Snap and Go is data generation system, and all of the information that is collected is actually transmitted to both operational software and clinical software. So the main idea is that the information reside on the current hospital software.
Do we need to use your software to access the data?
You can use our software, but you can, because that we are transferring all of the data to your software, to the Lawson, McKesson, and Epic, whatever it is, you can use your current software in order to use the data. This is exactly the idea. What IDENTI is thinking is that most of the hospitals today are lacking the data in their systems. And the Snap and Go and the image to data revolution is exactly built for that, to create data into your existing system. You can use your reports.
Okay. Does it solve the issue of misplaced implants in the trays?
If you will go, the Snap and Go is a tool that is actually located in the operation room. Now, when you deploy the Snap and Go, you can go what we call upstream and downstream. Because if now we know exactly what have been used in the tray or in the kit, sterilized kit that have been coming to the operation room, and we have constant data, now we can improve the preference card and the kit trays according to what have been actually used for the procedure. So this process is something that can be improved in a constant way.
How does it relate to specific patient in OR?
At the beginning of the procedure, the only thing that you need to do is to scan the procedure number. And the procedure number is actually the association in between the Snap and Go and the hospital system. So now when the system transfer the information to the Epic, for example, so the key that can make the merge is the procedure number or the case number, which is also located at the Epic, and now all of the information reside in the Epic or Cerner or whatever software the hospital is using.
Unrecognized items require data entry by the nurse?
No, never. This is the main idea. Never. We do not want the nurse to deal with any of this. As soon as we have the image, these go to the back office. So we have the first layer of back office. This is IDENTI. We make sure that we identify the information. And now, in case there is no match with the hospital reference number, it goes to the hospital back office. This is now done outside of the operation room, not by the clinical staff, but the people that are trained to be owning let's say the catalog numbers, the item master, all of this type of activities. It's not the nurse, definitely.
Would like to know how it integrates with supply chain tissue tracker and EMR and step needed to take to make this work, implementation plan.
It's a large question, but to answer it short, we are supporting many different communication protocols. We're supporting the HL7 communication protocol, and we can easily communicate with any software. It's a matter of, it's like, integration is like Tango. We need to talk with the people that are dealing with the tracker or with other software that is currently operating in the hospital, and we can create this connection, this linkage. But of course, this type of question need to be set and define the time frame. Typically, a typical, let's say, integration like that takes days, assuming that both sides are devoted to do that.
And last question, can it read all barcode types?
Sure. And even if there is no barcode. So it's not matter if there is a QR code or barcode or what type of structure of the barcode that you have there. Even if there is no barcode on the item, it's only symbols and wording. Of course, we can still extract the information.
Okay, so I think that we went over all of the questions. Thank you very much to join us today, and we will send you a summary and a recording of the session. And If you want to reach out to us, here's the information. You can log into our website, to our LinkedIn page, and request to book a meeting with our expert. And that's it. Okay. Hope you enjoy it and have a nice day.
Thank you very much. Bye-bye.